So our next panel discussion was going to be talking about reforming our healthcare system, but Lohman and I remembered that President Obama fixed all of that with the Affordable Care Act. So healthcare is affordable. We all got to keep our doctors, and pharmaceuticals are down. So mission accomplished. On to the next subject. Okay, because none of that happened, we still have to fix our healthcare system. To lead us in a thoughtful discussion of healthcare reform, again, because it's not enough to tell them what the left did wrong, it's how we would fix it. Someone we all know and have worked with over the years, from Americans for Prosperity, is Emily Brey. Emily has been leading us, fighting along with us, and working on issues and campaigns for some time. She's been with them for nearly a decade and is now the state director. To lead a discussion of a thoughtful panel of what healthcare should look like, we welcome to the stage Emily Brey and her panel.
Well, thank you so much, everyone. Thanks so much. My name is Emily Brey. I have the pleasure of serving as state director with Americans for Prosperity, the Commonwealth's largest grassroots organization. So just a quick point on that. What does grassroots mean? Well, it means that we're under the dome in Harrisburg and Washington, fighting for you, the hardworking taxpayer. There's an interest group, a lobbyist for every other interest group in the entire, that you can think of. For us, we're fighting for taxpayers, and for the purposes of this conversation, we're fighting for patients and not insurance companies. So we have a great esteemed panel here. We've got the chairman of the House GOP Policy Committee, Chairman David Rowe. Yes, give it up for Chairman Rowe. We have Lauren Stewart, who serves as the Senior Federal Affairs Liaison at Americans for Prosperity, my colleague. And we have Minaret, who's coming to us from the Paragon Health Institute. So thank you all so much for being here. One thing we hear time and time again from the progressive left is that Republicans are trying to take our health care. They make this sound like it's an abomination. And quite frankly, we're just here to actually, do some myth versus fact, just share some truths on that. So panelists, thank you so much for being here. When people talk about fixing healthcare in America, the conversation also, oftentimes starts with, we need more government involvement. Why do you believe competition is the right pathway forward? And let's start with Chairman Rowe for a state perspective, and then over to Lauren for that federal touch.
Well, thank you, Emily. For me, the issue of hospital pricing transparency started locally. I had a constituent reach out. She had done all of her homework. She'd done all the right things. She was a single mother with 3 children, and she needed an MRI. And she had done her homework. She called the hospital. She wanted to make sure she could afford it. She wanted to be fiscally responsible. The hospital got back to her, said it'll cost you $800 out of pocket. She said, great. She worked a couple weeks, saved the money, went to the hospital, had her MRI, got a bill for $4,000. And she reached out and said, well, I thought you said it was going to be $800. And they said, oh, well, no. It's $4,000. And then they turned her over to collections, and it just started this cascading effect. We ended up having a policy hearing up in my district to discuss this. And at the policy hearing, one of the employees of the venue came up and said, hey, I'm so glad you did this. I went to the hospital, and I got a bill when I left and a bill in the mail for the exact same services. The one in the mail was double the one that she got when she left the hospital for the exact same services. And she asked me, which one do I pay? Why does one cost more than the other? What's the difference here? When she reached out to the hospital couldn't tell her why either. So that's why pricing transparency matters. Because if you look at the private sector solutions to cost, right, use televisions for an example. In 1945, if you wanted to buy a color television, it would cost you about $1,300 in that money. Today, that would be about $14,000. But we know that's not the case, right? Because what we saw was an expansion of the industry, a streamlining of the process, massive competition. And now you can go to a Best Buy or a Walmart and you can get a 65-inch 4K TV that's, a smart TV that connects to your Wi-Fi for $500 compared to what would have been $14,000 several decades ago. So that's why when we look at pricing transparency, looking at the free market model, that's what brings costs down by creating competition and actually giving consumers and patients a chance to make their own healthcare decisions.
And on a federal level, I was just driving through town the other day and I saw there was an airplane with a message saying, Republicans are taking our health care away. I have yet to meet one person that has had their health care taken away by a member of this GOP conference. Can you share some truth about this?
Absolutely. So one thing I will differentiate, and I think it's really important, and it gets lost in the conversation all the time, is that health insurance does not equal health care, right? These are two very different things.
Yes.
The definition of care looks like seeing any doctor that you want, having accessibility, affordability, and like the chairman said, transparency. So in terms of taking your health care, that is not something that's happening. The left tends to talk about anything in healthcare as apocalyptic crisis. People are going to die, babies, puppies, it's going to be horrible. And then it comes to pass and you don't hear anything about it at all. So it's a false narrative, and really getting to the core of coverage does not equal care, and what that looks like is empowering patients. When you ask why is competition better, it's the golden rule. I grew up in a household where if I didn't like what my parents were cooking me for dinner, they said, you can go buy the groceries and you can then, have your Oreos for dinner. I have the gold, I make the rules. That's the same in everything, but it's really the same in healthcare in terms of who controls the dollars right now in healthcare. Who controls the dollars in healthcare? It's insurance companies and the government. And it is no wonder that the quality product that patients and American families get as consumers of healthcare, especially if you are on the Affordable Care Act, is absolute crap. You're seeing a third of your claims denied, your networks are continuing to shrink, so that whole narrative of they're taking your healthcare, they're taking your fake coverage where you pay astronomical amounts, I mean the equivalent of some people's salaries and premiums per year, to not actually get healthcare. And in terms of we're taking this away, what's really being taken away is the power that insurers have in this game. This administration, this Congress has made tremendous strides in empowering patients, giving you more control over the healthcare dollars, expanding things like direct primary care. I call it Hollywood care. Nobody in Hollywood, no movie stars are waiting 2 weeks for a doctor's appointment or anything like that, right? They want to see the doctor they want when they can see it. They want to text with their doctor. Those options, Congress and this president are bringing more to the forefront of Main Street America and at home. So that's what I would say on that front. It's a false narrative and just driving home that coverage does not equal care.
Absolutely. Now, in a recent AFP survey, we found that 44% of Americans believe that one of the biggest issues when it comes to affordability is very high costs of healthcare. 44% of Americans, nearly half. So, Elle, can you kind of speak to what makes healthcare costs so expensive in this current environment?
Yeah, well, I think that we have an absolute corporate welfare problem in American healthcare. Patients, when healthcare is truly deeply personal, I think we all have instances of having a family member with cancer or experiencing a neighbor and understanding the financial pressure that comes from a diagnosis, but also understanding the barriers that you face when it comes to the bureaucracy, the fact that you don't feel like you're in control, that your doctors and insurance companies are in cahoots. And the reality is American patients are met with bureaucracy at every single step of the way. You have to petition your insurance company, fight claims denials, try and argue and find the right doctor. Meanwhile, these corporate entities, including big insurance companies, face zero resistance when it comes to getting your taxpayer dollars. In reality, we send direct cash transfers from the U.S. Treasury to health insurance companies. And last year in the Affordable Care Act, almost 50% of folks that were on $0 plans, meaning that they did not pay a single dollar for their health insurance, did not use a single service or a single dollar of healthcare-related care. That meant that we sent $30 billion to health insurance companies for zero care rendered. The reality is that over the last 4 years under the Biden administration, from 2021 to 2025, federal healthcare expenditures increased by $1.6 trillion. So when we have a reconciliation bill that comes in and is really getting at abusive tactics by these corporate entities that are taking your taxpayer dollars and making your healthcare worse, not better, we're trimming out waste, fraud, and abuse and that corporate welfare system that everyone is experiencing today and truly trying to put the American taxpayer and the American patient back in the front seat.
So what I'm hearing then is that this Congress is working to doge the current healthcare system and really support patients and not insurance companies. I think everyone in this room would agree, we deserve that. And so, yes, thank you, absolutely, we should clap for that. So, obviously our current system on a federal level is riddled with waste, fraud, and abuse, but Harrisburg is no stranger to that. However, there's policies that, the chairman, your caucus, and, others have supported that would just be a more free market approach to care, like hospital price transparency, like extended practice for nurse practitioners. These are supply and demand solutions that we can bring to the table. But why don't you speak a little bit to Harrisburg and what that current climate looks like?
Yeah, so looking at the regulatory environment is one of those things that most people don't think about that, right? Because unless you are the provider, unless you are the hospital, unless you are you don't see those necessarily. But the American Hospital Association put out a great report that said that the cost of the regulatory environment on hospitals is $39 billion annually. $39 billion. And that money comes from insurers, it comes from patients. Insurers get their money from payers. So that's $39 billion that we are paying for. And it's important to note that when we're talking about cutting regulations, we're not talking about making things more dangerous, right? When you look at states that are less regulatory than Pennsylvania, you don't have patients falling ill and dying left and right? So we know that the regulatory state isn't actually making anything better. In Pennsylvania, for example, I went to visit a local hospital, and they had moved a television in a conference room, right? We're not talking about an OR. We're not talking about a patient's room. We're talking about a conference room. And they moved a television from this wall to this wall. They were not allowed to use that conference room until the department came up, looked at it, and said, yep, you can use this conference room again now. And that's the type of absurd regulatory things that we are looking at. These costs are being driven, and one of the things that we've seen as a result of this ridiculous regulatory and the licensing barriers, those sorts of things, is the mom and pop shops can't compete. The pediatrician I grew up going to, the locally owned pediatrician, they're gone. I know that the family doctor that my parents went to, they're gone too. They just can't afford to compete. And a perfect example of why that is happened one of my first years in the House, and they were talking about this new bill that would have added several hours of requirements for radiology and this requirement and that license and all these types of things. And when I asked one of the lobbyists, I said, well, this is going to kill the family-owned practices. They can't afford to compete. And he said, oh, well, the industry wants this. And what I told him was, well, the industry doesn't want it. The industry that can afford to pay the $100,000 it takes to keep you on retainer wants this, because they want this bill to put their competition out of business. So getting rid of those regulations, making it easier for locally owned small businesses, our family-owned providers to compete, starts with getting rid of those regulations.
Absolutely. And you spoke to the competitiveness of Pennsylvania, or lack thereof. I know we have a governor that claims he wants to get stuff done. Clearly, there's free market principles that could be top of mind for the governor's mansion that we have yet to see. Can you speak a little bit to how, this administration has talked about healthcare and?
Yeah, so we know, and this is ironic, right, that there's a lot of waste, fraud, and abuse out there, right? Attorney General Josh Shapiro admitted there was $3 billion in fraud in Pennsylvania. He admitted to it as Attorney General. As Governor Shapiro, he's not really interested in doing anything about that. So we've got several pieces of legislation out there. One of them would be Representative Owlett has a bill that's basically do not pay initiative that basically says that the department shall keep a list of people that are ineligible payees. So if they know that this person, whether tracking death certificates or we're tracking, a record of fraud and abuse, to basically say these people are no longer eligible. But it's frustrating for us when Pennsylvania is staring down a $5 billion budget deficit that the governor is not taking more seriously $3 billion in fraud that we are paying, that you are paying, that taxpayers are paying to subsidize for the bad actors.
And this needs to be addressed immediately, so I'm so elated to hear that your caucus is working on solutions here. Pivoting back to the federal level, we've seen a lot of back and forth within this Congress trying to find a solution forward. Obviously, in a midterm election, there's a lot of political implications when it comes to speaking about healthcare. How would you best advise that we as, conservatives and just taxpayers and, patients start talking about how to message healthcare in a productive way?
It's super important, and Elle alluded to this. Healthcare is personal. this is probably one of the most personal expenses any family has, right, is your healthcare, especially if something's wrong. So while there is tons of waste, fraud, and abuse, and this administration, this Congress has done a fantastic job of trimming that fat, I think the way that we message that, even beyond the things that, ring true to my conservative heart, which is saving taxpayer dollars, is we actually have the fairness side of this issue, right? Trimming that waste, fraud, and abuse, removing ineligible people from government entitlement programs that are for the most vulnerable, that are for the single mom, actually improve the quality of coverage and care that those vulnerable populations get. So we should be talking about how we are actually improving health care, not coverage, for the people who need the help the most. So in terms of waste, fraud, and abuse, I think that's absolutely how we frame it, because we do have the fairness argument on our side when it comes to that. In terms of solutions, this is not repeal and replace Obamacare. This is Obamacare, you're adorable, you can do your thing, but look at all of these other solutions that we have that are much more aspirational. And sure, you can exist over here, but as we continue to break down government barriers to direct primary care, to direct payer, to health savings accounts, transparency, well, the patient's going to get more empowered, and Obamacare is going to have competition, right? And it's going to bring down the cost of healthcare for everybody, because insurers, providers, hospitals are going to actually have to start responding to what people can pay, not these fake numbers that are subsidized by the government. So number one, on the waste, fraud, and abuse, we have the fairness argument. We're making these entitlement programs stronger and better for the most vulnerable populations who need it. And number two, Republicans have patient-centered reforms that will put American families back in the driver's seat of their healthcare.
Well, and to be quite honest with you, Emily, the reality is that conservatives need to get honest with Americans about healthcare, and be honest about the good things that they are doing as well. Yeah. We just experienced that coming off of the reconciliation bill, and I'm sure that all of you in the state of Pennsylvania have seen several ads and different things run about how many Pennsylvanians are going to lose coverage and how many deaths are going to occur, how many hospitals are going to close. But the reality is that there are building blocks that are deeply broken. On both the federal and the state level. And the reality is that they take advantage of the states and our state legislatures and sell them these sob stories that are just intentionally not true. In the Medicaid program at the federal level, we reimburse on average 7 times more for care that is rendered to an able-bodied working age adult than we do for the disabled, seniors, pregnant women, the people that the Medicaid program is intended to serve. The state of Pennsylvania quite literally receives more per dollar for care spent on that college student in his mom's basement playing video games than they do for the intellectually disabled or those that are indigent and receiving cancer care. That's not fair. We took steps to create more fairness on the federal level, and that should be communicated. On the state level, they're saying, now that you did this, now that you made the Medicaid program fair to who it was supposed to serve, our hospitals are going to close. But the reality is those lists of all of these hospitals that are supposedly on the brink of closure, it's kind of a gaze, it's smoke and mirrors. There was a list that was released of over 446 hospitals that were apparently on the brink of closure. So I kind of went behind the hood on that statistic a little bit. And just one healthcare system called Advent Health, they have more profits than Amazon, ExxonMobil, and Disney. Yet 17 of their hospitals were listed as on the brink of closure as a result of the Medicaid changes at the federal level. That's not true, and that's not honest. What we are doing is bringing fairness back, we are bringing competition back, and we are making sure that your taxpayer dollars that are being used to fund all of this, the Disney vacations for CEOs and their private planes, we're making sure that that goes towards your care. And we are doing great things. We expanded access to direct primary care. We expanded health savings accounts to more Americans than we've ever seen before. We are taking steps. We need to go on the offense about healthcare and not on defense, because I don't want to have conversations about what Democrats are saying is not being true. I want to have conversations about the great ideas that everyone on this panel and all of the people that we know that have to truly make everyone's life better.
And to your point, the progressive left does not own the market on how we talk about healthcare.
Yes.
That should not be the case. Now, it is a very personal and very complex issue that I'd love for us to break down a little bit further. When you see DPC, direct primary care, or HSAs, health savings accounts, what does that mean to everyone in this room?
Yeah, it's a tangible difference in the way you're able to kind of drive your healthcare. So me personally, I'm a new mom. My little boy just turned 1 yesterday. And there are a number of things, whether it's pediatric chiropractic care, which if you have a colicky baby who doesn't sleep, you'll want to do anything to kind of help fix that. Pediatric chiropractic care is something that does and did really help in my household, but that was something that wasn't covered under insurance. So because I had an HSA and had already kind of in my head, okay, I have this kind of emergency fund for healthcare that I can use if things aren't covered for insurance, that is also tax advantage. So a health savings account is a tool that you can use for qualified medical expenses, and anything you use it for, you should consider getting like a 20 to 25% discount on because of the tax advantage, right? So it's tax advantage, and it's kind of a little bit of an emergency fund that I can go and say, hey, I'm going to call this chiropractor or this provider who's out of network because the wait time's too long, and just go get the care that you want. It really puts you in the driver's seat of your healthcare because we go back to the golden rule, right? Cash is king, where you can go and be self-pay and not have to work through, are you in network, are you out of network, is there prior authorization? You just get to go and get the care. So when you have things like health savings accounts, flexible savings accounts, things of that nature, you're much more in the driver's seat of your healthcare. You can also have a much clearer picture of what you're paying for. The most clearest bills out there, I don't know if anyone in this room has ever seen them, but if you see a plastic surgeon's bill, you know exactly what you're paying for. The anesthesia costs this. It's because most of them don't mess with insurance, right? So you know exactly what you're paying for. You can break it up into payment plans. It really just puts you more in control and more knowledge behind your healthcare. In terms of direct primary care, I talked about it, Hollywood care, right? You get to text with your doctor, hey, my son has this weird mole on his arm and I can't get to the doctor, or I've been asking my husband to get it looked at for weeks, right? What does this look like? And that direct primary care, not going to the emergency room, which we know costs tons of money, not only for the patient, but for taxpayers as well. But just really getting that kind of quick, common sense care. So tangibly, for everybody in this room, it's how are you more empowered as a patient, as a consumer of healthcare, and what options do you want that you don't have that you can then open doors to in a more affordable and personal way?
I don't think it makes things more simple.
Yeah.
The reality is more options is good. You don't want to just be stuck with your average insurance company. I think the other thing, premiums are rising. That is a truth. The reality is there is a family of 4 that is going to pay over $40,000 in healthcare premiums this year. That's unaffordable regardless of how you cut it, regardless of what side of the aisle you're on. That is just a truth. And so when you have things like direct primary care, that's outside of insurance. So what that means is I'm going to pay $75 a month, and I get access to unlimited primary care visits. So when I'm sick, I get to go. When I want a physical, that's free. All of my imaging is included in that. So if I need an MRI or a CAT scan, et cetera, all of that is included in unlimited. They give you discounts to prescription drugs. So what that might empower you to do is to select the lower cost health insurance plan, a catastrophic plan or a bronze plan that people call junk coverage. But what they mean with that is they're not taking more of your money and they're not making you pay for it longer over periods of time. And so your deductible is a little bit higher. So for the vast majority of Americans who probably don't go to the doctor, if at all, or maybe 1 or 2 times a year. That allows you to save money monthly, spend that money in a better place, and have it tax advantage, and still have coverage. It's getting creative and outside of the bounds that everyone keeps telling us that we have to have, which is expensive health insurance that only goes through my health insurance company. That's a false choice. You can be healthy and see doctors and not have to have traditional insurance, and we're making that easier, and we're empowering that to have further knowledge so that more Americans know about it.
I will just add on that point, when we talk about fairness in healthcare, there isn't a gap of okay, most people don't have access to really good government insurance because we know that doesn't exist. And there isn't a gap in terms of healthcare innovations, both on the medical side or on the business side, right? direct primary care doctors, concierge care, things of that nature. The reason that the majority of Americans don't have access to these amazing innovations is because the government is regulating it out of your hands. It's just as simple as that. So what it looks like under this administration is working to roll that back. But these things exist. We're not in the Stone Ages of medical innovation or medical care delivery. We're in the Stone Ages of government regulation and wanting that control over who drives the healthcare outcomes.
Thank you so much. So I want to open it up to final thoughts. Chairman, starting with you, then to Lauren and Elle.
Sure. So looking at it from a very granular, localized perspective of what something like hospital pricing transparency, healthcare transparency, what that actually means for you, what it means for the individual, it means what we've sort of seen happen in states like Colorado or states like Indiana. Like, this is clearly a bipartisan issue, right? When you have President Trump institutes a price transparency initiative, President Biden doubles down on it, President Trump again. You have states like Colorado, Indiana, Virginia, Texas, blue and red states, both that are adopting these policies. What you're seeing is the emergence of the free market's almost magical ability to bring down costs. You're seeing the expansion of apps that you can pull up on your phone, type in a service you need, and it'll tell you what every hospital in your region, your radius of care, will charge you for that. And then you can make the best choice based on your finances, based on the type of care you need. You're seeing the reemergence of the family-owned small practices because suddenly they know how they can compete, right? When everything is opaque and you're not quite sure what the other guy is charging, when there's no free market, there is no ability to compete. Look at, car shopping. If you want to go buy a car, you can go to this dealership, you know how much it costs, and you can go to that dealership, and you know how much it's going to cost. Whereas when you go to a hospital, you have no idea what you're going to pay until you leave and then get something in the mail, and even then they can be two different things like I referenced earlier. So transparency gives back consumer choice. As Lauren referenced, the ability to cash pay, something that in my district, right, we have a lot of the Plain community, a lot of Amish and Mennonite folks, they exclusively do cash pay. So we'll enter into agreements with hospitals to where they can get a significantly reduced bill. I don't know if anybody here is on one, but I used to be part of a Christian Medishare program. And what that meant was instead of having insurance, you would send your monthly check directly to a person who needed the money. So they would get in a car accident, they need money, everybody would send their money to that person, and that person would go to the hospital, negotiate a cash pay rate, sometimes up to 90% off what the amount to insurance would be billed. I know I'm doing a lot of anecdotal things. My brother, when his wife was giving birth, it was a very easy, very quick delivery. She might not say it was easy, but it was very quick. And when the doctor came in, they didn't have opportunity to provide some of the services they usually provide. When my brother looked at the bill, he said, well, you guys never gave her that. That never happened. You never came in for that. But they were just billing it all to his insurance anyway. So they were going to bill the insurance company thousands of dollars for services they didn't even provide. And so that's the type of thing that transparency, consumer choice, empowering patients gives back to you the ability to make the best choices at the lowest cost for you and your family.
Yes.
I love the healthcare anecdotes. They are not few and far between, and I think that as conservatives, we need to do a better job of storytelling there, right? My last thought will be doubling down on coverage does not equal care, but also that you can tell how broken the system and especially the mental model is on the left when the President of the United States says something like, we want to give the money to the people so they can buy their own health care, and how that is completely ridiculed and completely unimaginable, right, in this state. That should not be unimaginable, right? It's unimaginable because Democrats and folks in Washington, D.C. think that they need to protect you from making horrible decisions about your health care. I do not feel that sentiment. I know many of you in this room don't feel that sentiment. But what we can all do a better job of is telling these stories and kind of empowering ourselves through policy in the state, through encouraging our lawmakers to say, I got it. I promise I can handle my family's health care. It doesn't mean we need to fully repeal and replace Obamacare. Like I said, it's adorable. Let's let it exist over there and bring these new solutions that we know are good policy, good politics, and good for patients to the table.
Absolutely. I think lastly, you have to talk about healthcare. The reality is in Pennsylvania and in all of the other 50 states, the Medicaid program is the #1 line item in the state budget. So when you want to repeal income taxes, when you want to do anything else and put money back in your pocket, you have to do something with healthcare. And every American deserves to have high quality, accessible, and affordable care. And continuing to subsidize that and spend government money on healthcare is not getting us there. So let's put the patient in the driver's seat. Let's let's get competition and let's get choice. But more importantly, let's make sure that we fix this issue for the next generation, or we're going to have the same conversation for the next infinite amount of years.
Absolutely. Like we said, healthcare is personal, it is complex, but the midterms are coming and we need to be productive in how we communicate our free market principles. So thank you to our fabulous panelists. And enjoy your PLC weekend. If you're interested in learning more, we have a table right outside, or head to personaloption.com. Thanks so much.